So you need to identify the cause and eliminate the cause. No, you're not. That's why we're here to help you. Hi, Tira. Welcome back to Dear Dr. Jaishree, a series where I will tackle all your skincare questions, whether it's acne or hyperpigmentation or deciphering your beauty shelf or anything in between. Dear Dr. Jaishree, is beauty sleep a real thing or just a myth? How can I help my skin recover overnight? This is really true. Your skin, just like your body, needs rest. It needs to recover at night. And why is that so? There are 3 hormones involved when it comes to your beauty sleep. Number 1 is melatonin. We all know of it. Now, melatonin is not just a sleep hormone. It's also a very powerful antioxidant. So it detoxes your skin. It fights against the free radicals while you're asleep. Number 2 is the growth hormone. It peaks when you sleep. Now, growth hormone will help in cell repair and tissue regeneration. So if you want your skin to repair itself, you need that growth hormone to peak. So you need good sleep. Number 3 is cortisol. Now, cortisol will dip when you sleep. So when it dips, it has all the anti-inflammatory effects. If it is peaking, there'll be a lot of inflammation. So if you sleep well, it's going to go down and all your acne, your eczemas, or even your dullness will reduce. So you do need your beauty sleep. How do you do it? Please stop looking at your cell phone or your television screen just before sleeping. It's always good to read something nice or listen to some nice meditative music or something very relaxing, something that you like. Do not think about what has happened throughout the day. Maybe you can do a little bit of journaling just before you go to sleep. Dim your lights and try to meditate and think of lovely things when you go to sleep. Dear Dr. Jaishree, my neck is starting to look older than my face. How do I take care of it properly? Now, this is a very common mistake that we all do. We apply products on our face, but we forget the neck. The neck is an extension of your face, so whatever you apply on the face must go on the neck as well. Whether it's a serum or a moisturizer or a sunscreen, do not forget to apply it all over your neck as well. Now, the neck, you must remember, is a very, very thin area. There's not much fat there. There's a thin muscle called platysma, and the skin is very thin. So it is more prone to fine lines and wrinkling and these bands as we age. In fact, they start at a younger age. So take care of your skin. The second thing is your posture. Always have your head aligned with your spine. So sit up straight, and whatever laptop or gadgets that you're using should be a little on the higher side so that you don't look down constant. And finally, you can do a few exercises. You can move your hand gently upwards like this after applying a moisturizer. You can do a little bit of chin tuck, so touch your chin to your chest like this. Do that for about 5 times every day, and that will help you. Finally, if you have lines, we do treatments like radiofrequency, HIFU, laser resurfacing, etc. And it's always better to start early. The moment you see some damage, please consult with your dermatologist. Dear Dr. Jaishree, no matter what I do, my dandruff just won't go away. Is there a permanent solution? My dear friend, perhaps you're suffering from a condition called seborrheic dermatitis or even psoriasis of the scalp. These are inflammatory scalp disorders which look like dandruff. You have thicker scales and flakes on the skin. Now, first of all, it's important to maintain scalp hygiene. So make sure you wash your scalp every 2 to 3 days. Second, if you're sweating a lot, you must make sure you rinse after your workout or whatever sport that you play. Third, maybe you have a little bit of an yeast infection. A lot of times, dandruff occurs due to this organism called Malassezia furfur. So it may be worthwhile trying a shampoo which contains zinc pyrithione or ketoconazole in it. Then you must avoid product buildup. So do not sleep with a lot of product on your hair. You may be using a hair mousse, a spray, a setting spray, anything, but try to wash your hair or rinse your scalp at night before you go to bed, especially on days that you think you've added a lot of product on your hair. Finally, my dear friend, if the dandruff just doesn't seem to go away, you may be suffering from an inflammatory scalp disorder called seborrheic dermatitis or psoriasis. So you must consult with your dermatologist in order to be able to treat that medically. Dear Dr. Jaishree, my dark circles just won't quit no matter how much I sleep. What's the real fix? Or am I stuck with a concealer forever? No, you're not. That's why we're here to help you. I think most of us suffer from dark circles. The most common reason, of course, is lack of sleep. Then comes stress, sun exposure, smoking, allergies, both eye allergies and allergies to cosmetics, whatever makeup you're using. Anemia, that is low hemoglobin. Rubbing your eyes constantly, that friction also leads to dark circles. Then if you're constantly straining your eyes, you're looking at the laptop throughout the day or your cell phone throughout the day, that can also result in dark circles. Certain medications, certain hormonal imbalances such as PCOD, hypothyroidism can also result in dark circles. So you need to identify the cause and eliminate the cause. For example, if it is smoking, you need to cut down or quit smoking. If it is an allergy, you need to treat that. You need to stop rubbing your eyes. You need to wear your chic dark glasses and your sunscreen. Do not forget to moisturize your under eyes. Okay, your skin here is very, very thin, so it needs more hydration. And finally, you have to consult with your dermatologist, opt for certain creams which have vitamin C, kojic acid, even vitamin K in it, and that will help in reducing the dark circles. We do glycolic acid peels. We also do pico lasers or Q-switch Nd:YAG lasers to reduce the hyperpigmentation. And if you have hollow eyes, a lot of times the shadow that is cast when light falls on it will make the under eyes appear dark. So then in such cases, you may need under eye fillers. Consult with your dermatologist for more. I hope you enjoyed this video. Make sure to follow Tira's YouTube channel for a lot more on beauty.